Tonight I'm going to take a few minutes of your time and talk about a disease that hits close to home in our family called spinal muscular atrophy. Spinal muscular atrophy is one of the most common rare diseases in the United States, affecting mainly Caucasians, 1 to every 6,000 to 1 every 10,000 individuals across the United States. This is a life-changing disease not only for the individual, but also for the family who cares for that individual. Spinal muscular atrophy is a neurological disorder that belongs to a group of diseases in the hereditary family, which causes weakness in the arms, legs, and respiratory function in the body. The disorder is caused from an abnormal or missing gene called the survival motor neuron gene 1, or SMN1 for short. This gene is responsible for the production of an essential protein for the neurological motor genes in the body. SMA is an autosomal recessive gene, meaning that both parents have to be carriers, and both carriers have to pass the defective gene to their offspring. SMA runs in families, so most parents are not carriers and show no symptoms in their phenotype. Spinal muscular atrophy has 3 severities. Type 1, known as Wernstein-Hoffmann disease or infantile onset SMA, is evident at birth within the first 2 months after birth. Symptoms of this type include floppy arms, legs, or trunk, and bad movement, bad swallowing, and feeding impurities. Type 1 SMA is the leading genetic cause of infant deaths with SMA. SMA type 2, or also known as intermediate form of SMA, symptoms usually begin between 6 months to 18 months after birth. Legs tend to be more impaired than arms. Children with intermediate form may be able to sit or stand or walk with help. Type 3 SMA, also known as Kohler-Wieslander disease, appears between ages 2 to 17 years of age. This includes difficulty running, climbing, or walking, but can be aided again with help. Lower extremities are most often more impaired than upper extremities. Treatments for SMA are 0. Currently, there are no cures for SMA. Infants generally die with type 1 SMA due to respiratory impairment within 2 years after birth. Milder forms of SMA can live longer lifespans with extensive medical care. Spinal muscular atrophy could very well affect someone in your life because it is, again, the most common of rare diseases in Caucasians across the United States. SMA is life-changing, again, not only for the individual, but for the families who care for them.